everybody. Welcome to this week's episode of Ask an Expert. I am thrilled to be joined here by Dr. Angie Yates, and she is going to be covering a very important topic of equine ulcers. And even just like being in the green room before this, and we started getting on the topic, and this is going to get really interesting, you guys. There's so much that we don't know, or I don't know. I'll speak for myself. But before we dive in, thank you so much for joining us and for sharing your expertise with us tonight.
Absolutely. Thanks for having me.
Yeah. And so if you guys have, as always, if you guys have any questions at all, feel free to put them in chat. I will be monitoring that. And then we also received several questions ahead of time from members. So I'm going to get started with those, but definitely chime in chat if you have any follow-up questions or any additional questions come to mind. But I think, and also worth mentioning here that Dr. Angie and I are both experiencing interesting weather right now. So if we do lose connectivity, we will get back as soon as we can. But just to give you a heads up that might happen tonight. And, we're going to just go with the flow and hope for the best. So I guess kind of just to get us started here, let's start by kind of just discussing the equine stomach and really start with the more general topic of, can you describe to us kind of how the horse's stomach is built? And you had mentioned the hind gut and the foregut. And can you kind of define those terms for us and give us a picture of kind of the horse's stomach as a whole?
Sure. So one of the things, like we talked about in the green room, that I wanted to address first of all is the fact that a lot of times clients hear the terms foregut and hindgut in marketing materials, and they think that applies to different parts of the stomach. And so the foregut is the mouth, esophagus, stomach, small intestine. The hindgut refers to the large intestine and the cecum of the horse. So while there are two different parts to the horse's stomach, those are not the foregut and the hindgut. Those are the squamous and the glandular portions of the stomach. And so that's what we're referring to when we talk about the different parts of the stomach. So the esophagus comes into the stomach. That's the tube from the mouth to the stomach. And then you're in the squamous portion initially. And so anyone that's seen a horse scoped, that's the lighter color mucosa. So it sometimes looks white or like a very light pink. And then you get down the mid part of the body of the stomach, there's a line, and that's called the margo plicatus. We have no idea who came up with that name, but you learn it in freshman anatomy. And so that's the line that separates the squamous from the glandular portion of the stomach. The glandular portion of the stomach is the bottom portion, and that mucosa can be either a very dark pink or red. And so there have been a lot of times where I've been scoping a horse and I drop into the stomach and I hear the client gasp and they say, oh my gosh, what is that red? Is that all the ulcer? That's actually, that dark pink or red color is the normal color for that part of the stomach, that part of the mucosa. And so that line between the two of them, that's the margo plicatus, a lot of times you will see ulcers around that line, but that's the line where you've got two different tissue types. And so the glandular portion, I did hear a client the other day say the way she remembers it is that the G goes down. And so that's how she remembers squamous versus glandular. So those are the main portions of the stomach. And so it's really important, since both of those two tissue types have different risk factors for ulcers and different treatments. That's why we scope, in order to see where the ulcers are. Are they in the top part of the stomach, the squamous portion, or are they in the bottom, the glandular portion?
Is there a more common, like, I guess we can jump into the different types of ulcers, but is there like is it more commonly that they are in the squamous portion or in the bottom portion? Or is it equally as likely, and it just depends on the scenario?
I would say, based on the number of horses I scope, I meant to look this up, but I would say we were somewhere around 100 mobile scopes in Ocala just last year for 2023. So it's somewhere around there. And I would say it depends on what the horse does for a living and the breed of the horse. And that seems to be supported in the literature. So typically what we see in thoroughbreds are mostly squamous ulcers. warm bloods do tend to be more predisposed to glandular ulcers. And again, the treatment for those two different types of ulcers is completely different. And so we always want to make sure that we know what we're dealing with. But I would say it's roughly 50-50, but the breed of horse really impacts what type of ulcers you're dealing with.
Super interesting. And can we get into a bit more detail about those two different types of ulcers? Like, do they present differently? Kind of what is how does the treatment differ? And kind of what is the outlook or the diagnosis? How does it differ between the two different types?
Okay. So the squamous ulcers are the ulcers that you think about that have been described since, say, the 90s. So equine gastric ulcer syndrome has been described since the 90s. It wasn't until much more recently that people even knew that there were two different types. So, to date myself, I started vet school 20 years ago. And when I started school, one, the scopes weren't as long as what we have now, so it was harder to get down to the bottom of the stomach. Two, the recommendation back then wasn't to fast horses as long as what we fast them now. So when I was in school, we would fast horses for about 12 hours. Well, at a 12-hour fast, that bottom portion of the stomach is still completely covered with feed material. So now it's much more routine to do a 16-hour fast. And it's much easier to get down to the pylorus which is the opening between the stomach and the small intestine. And so that's where a lot of your glandular ulcers will be, is right there at the pylorus. And so that led to not really knowing that there was this other type of ulcer that was such an impact or even a concern, really. So most of the marketing material still is aimed at a squamous ulcer, which is that stereotypical, what we read about, horses locked in a stall for 23 hours a day, high grain diet, very little forage, maybe an exercising racehorse, something like that, but much more in a man-made environment where they don't have a lot of natural foraging and they don't have a lot of access to forage and are fed something like sweet feed. I would say just in the past 10 to 15 years, especially, so many of our nutritional choices and our management choices have started to change to alleviate some of those risk factors. But the squamous ulcer is going to be up in the top part of the stomach in that light pink color. And those are more of your stereotypical, what you'll read about when someone talks about ulcers. The glandular ulcers are so much more poorly understood because any research paper that you pull, one of the first things that it talks about when it says glandular ulcer is the pathophysiology of a glandular ulcer still isn't well understood. We do know that warm bloods do tend to be a bit predisposed. And that bears out with what I see when I scope horses around Ocala is, generally speaking, a thoroughbred is going to have a very nice pylorus when I get down to the very bottom of the stomach. The warm bloods are more the ones that tend to have the bleeding glandular ulcers. And that's what they found in the literature so far. And so that's one of the things that when I practiced in Indiana, I tended to have this conversation more. I know one of the questions that had come up on the Facebook page earlier today was someone asked, why scope instead of just treating? And definitely it bears out with what I see every day in my practice. No two stomachs are ever alike, and most of them aren't even similar to one another in terms of, you can have a horse that has got grade 3, grade 4. You can have a horse that just has something called hyperkeratinization, which is just some extra protein that the stomach lays down in order to act like a Band-Aid. That's just a mild form of irritation. You can have a horse with just squamous ulcers, just glandular ulcers, both. And so that really dictates what you want your treatment to be in terms of which drugs you use and how long. So it's not a simple matter of does the horse have ulcers or not, but it's how bad do they have ulcers and what type of ulcers do they have. I do scope horses that actually don't have anything. So that is a possibility that even someone that says, wow, this horse has all these stereotypical behaviors, or they crib, or their weight is bad, or something like that, we need to check their stomach. And sometimes you do go in there and you don't see anything wrong. And then you know that, okay, we've ruled that off the list. We need to look at something else.
Wow, the no two stomachs being the same thing is wild. I had no idea that was the case, and must make your job really interesting.
It's very interesting for sure. You never know what you'll find.
Yeah, keeps you on your toes for sure. Can you describe a couple of like the common symptoms of ulcers? Like, what are things that people should be looking out for with their horses that might be indicators that they should get their horse scoped?
Yeah, for sure. And this is something that when I was pulling some of the research papers, just cramming a bit before we sat down, what I find interesting about this in the research versus in real life is in the research, all these research papers will say, well, we don't really see a consistent link between certain types of behavior and ulcers. I think as horse people, we can look and we can say, one of the things that I absolutely think warrants a scope is if you go to feed your horse grain and they consistently will take one bite and walk over to the corner, and they don't act like they want the rest of their grain when they were perfectly fine 15 minutes ago, that I think is a really big indicator for a horse that needs to be scoped. Horses that will preferentially eat their hay first, sometimes those horses are just really smart, because they will, and I've had a couple horses like that I've scoped their stomachs, they're completely fine, but their preference was always to start with their hay. So they would lay down that fiber mat and they would get that buffer in their stomach before they took a bite of grain. But I do think that is something that warrants a scope. Some of the other things under saddle, I think, are specific to different horses. I mean, I do think that horses that are behind the leg can be horses that need to be scoped. Definitely horses that are behind the leg don't want to go forward. Different scenarios where they're always bad in a certain scenario, like they don't want to drop down. Those horses, I think, potentially warrant a scope, because we have to think about the acid in the stomach, the normal fluid level sits towards the ground, and especially since they're on 4 legs, we're on 2. So we have to think about, okay, what does gravity do, and where does gravity influence the horse? So as the acid is on the bottom layer of the stomach, if the horse is performing certain behaviors, like they go to take off from a jump, they drop down, then sometimes that acid can splash up and splash on the top of the stomach, the bottom of the esophagus. I did scope a driving horse the other day that he initially, when he was scoped up north before he came down to Florida, he had very bad ulcers right as the esophagus was coming into the stomach. So that was a horse that the acid was splashing up on the top part of the stomach. So horses that also, potentially have a poor appetite, some of these thoroughbreds that come off the track, people are doing their best to let the horse down well and to get them integrated into more of a sport horse life, and they still don't eat very well. You can give them a full hay net of alfalfa and they just kind of pick at it. Those horses I like to scope. So it can be specific to individual horses, but those are some kind of broad topics. And I would always tell a client, if a horse starts doing something that wasn't normal for them, and you think it's kind of a weird, quirky behavior, like in particular, the glandular ulcers, and I don't have a reason for this, I feel like some of those horses can have really odd, quirky, very idiosyncratic behaviors that sometimes people say, oh, that's just that horse. It's a bit weird about things. Spookiness sometimes can be ulcers. I would say spookiness, the 3 things we worry about are ulcers, Lyme, and EPM. But I think anything that either impacts their eating or impacts certain behaviors under saddle, I think it's worth it to scope horses. Oh, Kenzie, I lost you.
Can you hear me now?
Yep, there we go.
Without there being a rule of thumb about like if this is happening, you should definitely get your horse scoped. Would you say that there's definitely like a lot of horses that are going untreated? Like I'm imagining.
Yeah. Yeah, for sure. For sure. And it's come to my attention. I was talking to one of my friends earlier today, and she was talking about being on one of the message boards that's pretty popular. And she said, I was really surprised because there were all these people on the message board today saying, wow, I would never scope my horse. It's so invasive. And, I just don't feel the reason to do it. And honestly, of course it varies between do you have access to it? Do you have to haul in to do it? Do you have the opportunity to be able to do it, on the farm? Who's the operator? What's the equipment? Those kind of things. I mean, honestly, the thing that makes us feel the worst about it, just as horse owners in general, is we don't like to fast them for 16 hours. If when I do my own horses, I just kind of have to just say, okay, I'm going to check on you, but I'm going to run out of the barn because I'm sad that I'm not feeding you. So, I mean, I can completely empathize with that as a horse owner, but really there are few risk factors to doing it. So it's not something that, yes, there is some level of invasiveness, but it isn't overly dangerous.
Yeah, I can see myself being like every little symptom being like, "Oh, I want to get my horse checked," and that could be the other extreme is checking too much. Um, One question we just got from Debbie is, and it's related to something you just said. She's just saying, should we be feeding hay prior to get grain in the event that they don't have hay left over? Kind of to your point of the smart horses will eat their hay first.
Yeah, and that has been one suggested management style. And I've said this to a couple of trainers recently, especially people that are in a bigger horse operation. It ends up being easy for them or their staff because what they can do is they can start with the first hay, the first horse getting hay, and then say they've got a 20 horse barn, they can go all the way around, give every horse hay. And then by the time they get to the last horse getting hay, once they start over again for the grain, that first horse already has some hay in their system, and then it just acts as a buffer and a fiber mat. So then when they do get their concentrate, and I think, we talked about going out off on a tangent, so I'll try to not make this too long, but I do find also that clients nowadays don't really understand that what we're feeding in terms of concentrates isn't grain like it used to be. When I was a kid, grain was we fed straight oats and maybe you fed sweet feed and there was molasses and corn and oats, and it was a true cereal grain type of feed. Generally speaking, with what our commercial concentrates are now, if you flip over the back of your grain bag, you're going to see beet pulp or wheat middlings as or soybean hulls as your first ingredients. So that is not grain per se. I mean, for instance, what's in my barn, the first ingredient is beet pulp. And it's a commercially available feed that a lot of us feed. So I will say that generally speaking, unless you're feeding grain, true cereal grain from the local feed mill, already what we're feeding in terms of concentrates is better than what we fed 20, 30 years ago, for sure. And there still are horses out there eating cereal grains, but then we go back into, if they truly are eating cereal grains, then we have to go back into we really want to buffer the acid that's produced when those grains, because we're talking about a lot of sugar and a lot of starch. And so if we're talking about a lot of sugar and a lot of starch, then as that ferments, because horses are hindgut fermenters, that is in the large intestine, which is part of the large colon, then we have to make sure that we're really doing our best to buffer that with different supplements and forage and things like that. I would say that most sport horses now are not eating cereal grains. They're not eating sweet feed. That tends to be more in other disciplines. But most of what we're eating and feeding now is foraged based concentrates. So if you feed a nationally commercially available feed, that is a lot of times soybean hulls, wheat middlings, beet pulp as first ingredients.
Yeah, so moving in the right direction as far as like that would be preventative in its own right. Is that fair to say?
Right. Yeah, absolutely.
Okay. That's a good kind of segue into Paterka's question, which they're asking kind of what are some environmental factors that help with ulcer prevention? And maybe we just answered it and let me know if we did. And then they're also asking about training factors.
So, environment, I would say a little bit what we were talking about earlier, where over the years we really have tried to move toward more of a natural environment for horses, that turned out more, less time in the stall, more access to forage. In general, you always want horses to have access and to eat, hopefully, 2% of their body weight in forage a day. That is a lot easier to measure if you're in a situation where, like, say, there's snow on the ground up north right now. You know that your horse's entire amount of forage is coming from hay. So, if you've got 1,000-pound horse, you want them to eat 20 pounds of hay a day. And that can be a struggle, not so much here in Ocala, but when I practiced in Indiana, I would have clients that would be in boarding situations, and to try to get a barn owner, for instance, to be willing to feed 1,000-pound horse half a bale of hay a day, sometimes that was a hard sell. But definitely the more we can let them be in a quote more natural environment in terms of turnout, the amount that they're out with buddies and in a herd situation can go either way. So there have been studies that have shown they're less prone to ulcers in a herd situation, and studies that have shown them to be more prone to ulcers. And I think that as horse people, we can all see where that goes in terms of, if you've got a horse that's at the top of the pecking order and the boss, they probably are not going to have as much stress as the horse that's at the bottom. If you've got a horse turned out in a 5 or 6 horse herd, there are some horse people that would say, yep, that's great. We need to always do that, but there's a happy medium to everything. And the right answer is always in the middle. If that horse is constantly coming in and they're beat up and they've got bite and kick marks, that horse is experiencing quite a bit of stress. So as a vet, it's always been a bit of a frustration for me when I have a very well-meaning owner and client that really wants to do the right thing for the horse, but maybe their situation, whether they're in a more urban or suburban area, that there just isn't the land to have the amount of turnout. Then we start looking at ways, okay, how can we make their stall more enriching? When they hang toys and put toys in their stalls. I have had clients over the years that the barn owner just absolutely refused to feed more hay. They've actually gone and bought more hay themselves, and then they've hung a small whole hay net in there. Just, they've done the work. And then that way the horse always has something to eat. I can say I had this conversation with a client the other day, and we were talking about the fact that now that we've moved to Florida, our horses are out all the time where we can see them, with the ability to bring them in if the weather's bad. But we were just talking about the fact that when horses are out all the time, or the majority of time, it's interesting to watch them just freely, because they don't eat as much as what we think that they do. Versus we've all seen that horse that maybe they say get, for instance, 4 to 5 hours of turnout a day, and you unclip their lead rope and they immediately just run out and they put their head down and they just eat and eat and eat until you get them in 4 to 5 hours. And to watch these horses out pasture for 18 to 24 hours and be able to look out the window, and they stand and just rest so much more often than what they do in other situations where they're not turned out for as long. And so I do feel like my own horses, since moving to Ocala 3 years ago, when they're out on, 3-acre fields for each horse, their behavior is totally different than when they were in a more confined situation. When they lived in Indiana, I would say they would maybe be out for 6 to 8 hours a day and then in for the rest of the amount of time. But definitely, if they have to be in, providing them with as much hay as you financially and practically can provide them is a huge management strategy.
Got it. And from a training perspective, is it just like managing their stress, or are there other indicators that you've seen that can help prevent ulcers?
So one of the research darling papers right now that is very interesting, but now it's starting to get old because it's from 2018, but it seems like everyone has discovered it. Like one of the media outlets picked this up the other day. And like I said, it's 6 years old now, but they looked at risk factors for ulcers in Canadian show jumpers. And one of the reasons why that paper is so significant is because most of our research in horses is based on the racehorse population. It's a population that is very homogeneous. You know, it's very easy to do research in that population. The horses are all the same age, they're all the same breed, they're all managed the same. So a lot of our research is based on the thoroughbred and standardbred racing populations. So to have this population of horses where they looked at the Canadian show jumpers, and they found that exercise of 6 or more days, so 6 or 7 days a week, really increased the prevalence of ulcers. And they also found that the number of handlers increased the ulcers in the horses. And the way they did this is they looked at 83 horses within a 200-kilometer radius, and then they did a questionnaire where they asked about all their management factors, and then they scoped all the horses. So that was how they came up with their data set for that. And so one of the things that they found interesting too is horses that were competing had a higher risk of ulcers, but then horses that were competing at the FEI level had a lower risk of ulcers. And so they were trying to kind of draw conclusions based on that data set. But it does seem collectively with what they found with those 83 horses was it was a risk factor to exercise them 6 or 7 days a week. The number of grooms or the number of riders really increased the stress of the horses. And so that increased the risk for ulcers. But I mean, we would hypothesize that if a horse had one groom, one rider was showing at the international level, that person probably rides pretty well. And that groom is probably pretty top notch. And so that's just, and again, that's my opinion based on that data set is I think anything that we can do to minimize stress in the horses is always going to be a good thing.
Yeah, absolutely. What are, and this is a question from Liz. She's asking kind of what are the steps that you recommend taking if you suspect your horse is having GI issues? And then she has some other questions as well, but we can start there.
So if someone calls me and says, hey, I think this horse is having a GI issue, the first thing that I'll probably do is just do a full physical exam. And so that's just everything from nose to tail. I think it's not a direct impact on this talk, but I do think that we can't forget their teeth. So their teeth are part of their mouth. It's part of their digestive system. And so sometimes when I'm looking at, are we trying to rule ulcers in or out? I will find that, say, a horse really needs to have their teeth floated badly. And, someone will say, oh yeah, it's been a while. So I do find that to be an incidental finding some of the times. So full physical exam, depending on, what other signs that the horse is displaying, a CBC and a chemistry just for routine blood work, and then probably a fecal exam as well to just check a fecal egg count. And then if all that checks out normally, or maybe some of it doesn't, then I would potentially say, okay, later in that week or the next week to say, we'll fast the horse for 16 hours and then we'll scope and we'll look and see. I think that this is probably a good time to bring up too, that there was, and maybe still is on the market, a fecal occult blood test that had been advertised to be able to check for ulcers just by checking the fecal. And that has actually been debunked now in several studies. The most recent ones were in 2018 and 2019. And so I believe that company still makes the digestive product, but the fecal occult blood test that goes along with that, they've actually shown in several papers papers that it doesn't agree well with gastroscopy versus the fecal cold blood test.
Got it. And she's asking as well, kind of what are your what is your protocol recommended for GI health when horses are purchased either domestic or overseas, and the best ways to prevent issues with new horses?
So the program that I ride as part of, I think we've imported 5 horses from Europe just this year. And definitely as soon as they're purchased, we put them on GastroGuard over in Europe. So before they even go to quarantine over there, get on the plane, fly, land in Miami, any of that, they're on GastroGuard for the whole trip. Typically what we've been doing is not scoping them right away when they get here, but I would say within the first month, they're all scoped just to see kind of what we have. But in order to try to minimize the stress to the stomach as they're traveling, we just do prophylactic GastroGuard and make sure that they're on something when they fly.
And this was a question from Debbie in chat. She's wondering, does like the fasting ever like irritate or make could fasting for 16 hours create ulcers? Like, is that ever going to be like a stress inducing situation?
Yeah. Yeah. I mean, I think we all worry about that, and that would be a deterrent to some people to not scope. But I think that the most recent time period that has been found is that ulcers can be created in 3 days is the lowest amount of time that I've seen. And I just pulled the 2023 research paper, the review article, to see. And so that's the lowest number that I'm seeing at the moment. And so I think it's probably the hardest on horses that are in a big barn and they, are watching everyone else get fed, and we feel bad for them. And, like you said, as long as you're not doing it all the time, I think that they typically handle it just fine.
Yeah. Absolutely. So that you actually just answered Hannah's question, but Steph was wondering, and I think this was actually Hillary put this in chat as well. Can ulcers or stomach discomfort cause skin issues or skin irritation?
I think it usually is the other way around. So one of the things that we found in the farm program is horses where we cannot get their stomach healed for whatever reason. They're on all the things, they're on all the appropriate amounts and drugs and all the FDA approved products. And we scope, and then 30 days later, we scope again, and 60 and 90, and we keep going. Those horses, almost 100% of the time, I can't think of one actually that's an exception. Those horses, we find out, have some underlying discomfort somewhere that is causing them stress, whether it's a joint that's been bothering them, it's this weird underlying lameness that's kind of subclinical. But I feel like that would actually be the opposite, where a horse could be really uncomfortable and just kind of low-grade subclinical itchy. And I mean, everyone knows that our skin problems down here are legendary. And so horses that really bothers and causes a subclinical amount of stress, I think that will affect their stomach. The skin will affect the stomach, not the stomach affecting the skin.
That makes sense. If left untreated, is it ever gonna kind of rectify itself? Like, will horses ever just like get over it, or what is the real risk factor of if you don't notice, you're not picking up on these signals?
Yeah, I think that a lot of times horses go one avenue or another. I mean, we know about how quickly ulcers can develop, but what we don't know is, like, for instance, if I send a horse for an MRI and there is a lot of fluid around a structure, the radiologist can roughly determine about how long that lesion has been there. When I scope a horse, I can't tell how long, whether it's been days, weeks, months, years, how long they've had the ulcers. All we know is that they're present at that time. And so it's hard to say what would happen in terms of, say, a horse that had ulcers for a year. I feel like their behavior tends to take one path or another. they either get to the point where they're stoic enough, they just live with it, or some of the very sensitive horses, their behavior can potentially start escalating, and to the point where, they get sent to a cowboy, or they get sold, or, they get turned out in a field. So I do feel like their behavior can take one path or another, but it does seem to be a behavior type progression rather than a physical type of progression. I mean, certainly the worst form of an ulcer is an actual perforating lesion where the stomach truly develops a hole in it, and then you have stomach contents that are leaking into the abdomen, and that would result in the horse not living. That's pretty rare. So I don't want people to go away thinking, oh my gosh, if I don't get my horse scoped, it could develop something that would, eventually become perforating. Almost every example I can think of, if it matters to the horse, their behavior has escalated to the point where it gets to such a level that something happens. They get sent to a pro, or their management changes, or something happens, but it tends to be behavior.
Got it. Yeah, you'll reach a moment where it's like at this point we have to check.
Right.
Like stuff is changing enough that it's the time. Lee is asking, what is the typical cost to scope, and is there any way to scope or test for hindgut versus foregut?
So cost to scope, I mean, like anything, it's going to depend on where in the country you live, and whether or not you can get it done on the farm versus the hospital. So I charge around $350 on the farm. In the hospital, it can be double than that, because the horse a lot of times will come in the night before. You'll have a day of board. You'll have a lot more monitoring and things like that. So I have heard $600 to $700 here in Florida if they have to go into the hospital. I would say Midwest, 350 to 400 would be more what I would be used to when I practiced in Indiana. And again, when you've got FDA approved products that can run you $1,000 to $1,200 a month, it turns out that, and this is probably a good time to bring up the fact that the treatment for squamous ulcers is not always just GastroGuard 1 tube a day for whatever price you find it for. You can have efficacy on a quarter dose, half a dose, full dose, and that is backed by research papers and research studies. So for instance, especially if finances are a concern, it's really important to point out that, say I have a horse that's got some very mild ulcers in the squamous portion of the stomach, and someone says, hey, I'm really concerned about cost. I would absolutely put that horse on a quarter tube of GastroGuard a day for say a month, and it would be a quarter of the amount of what a lot of times people are thinking about spending for something like that. In terms of hindgut ulcers, that is a little bit poorly understood and controversial, because I mentioned the fecal occult blood test before. That was one of the reasons why people were so excited about that test, because there really is no ante-mortem, meaning in a living horse, way to test for hindgut ulcers reliably. And for instance, before I sat down tonight, I typed in equine hindgut ulcers into PubMed just to see what would come up, and I got 0 citations. If you type in equine hindgut into PubMed, you get 190 citations. And so what the research is being done on is the microbiome. I mean, in humans too right now, gut health is a huge buzzword. So it's that way in horses and ruminants and dogs and cats. And so gut health and leaky gut syndrome is definitely, a huge buzz phrase right now. And so most of those articles are looking at the pH of the large colon and which organisms, which bacteria and yeast and, how feeding concentrates or feeding certain types of hay affects the organisms that live in the hindgut. So none of those papers actually address any ulceration of the hindgut when you type in equine hindgut. Now, there is something called right dorsal colitis that is a medically relevant and true condition. And what that is say horses have been on just very high amounts of nonsteroidal anti-inflammatories in the right dorsal colon, which is part of the large intestine in a horse, they can get ulceration there. Most of our horses are not living on high doses of nonsteroidals. So that can be a bit confusing for the average horse owner to navigate with the marketing materials, because everywhere we turn now, you're seeing marketing that's talking about your horse's hindgut health. And since there is no true antemortem diagnosis for hindgut ulceration, then the marketing comes into a lot of play there. There is a way that, for instance, say you have a horse in the intensive care unit in one of the hospitals and you're worried that they do have right dorsal colitis. There is a technique that you can use the ultrasound from the body wall and measure the thickness of the right dorsal colon. But that is not a condition that our average horse that we have on our farms that we're actively riding and competing would have. So that issue's a little bit cloudy with marketing materials and what is and isn't, what is fact and what is opinion, I guess. So that, I think you have to really be careful and take some of the marketing with a grain of salt, because again, when I type equine hindgut into PubMed, I'm not looking at citations for ulcers. I'm looking at citations that, for instance, the feed companies and the nutritionists and the equine nutrition PhDs are using in order to help formulate some of our feeds.
Super helpful. And yeah, like the marketing can get kind of out of control. It's like you just assume, you take it for its word and you're just trying to do the best by your horse, and it's like, oh man, like this is actually, you're not realizing what you're paying for, what you're giving them.
Right.
So one question we got in chat was, this person has a horse that eats a ton of hay, and no matter how small this hay nut they put it in and how much they try to slow them down, they can't just like keep giving them hay to avoid obesity. Is there something better that you would recommend as like a method for horses that fall into that category?
Yeah, that's always hard when we've got the ones that we're worried about them putting on too much weight. So something that's worked for me in practice would be, with just personal horses, is trying to put them in not a real dry lot that has nothing, but something, say you mow the grass really, really short and there's just enough for them to pick at all of the time. They're not really getting nutrition, but they think that they're grazing. Obviously that's only going to work in certain circumstances in terms of environment. If that person is in Boston right now and there's snow on the ground, that's not going to work for them. Just very recently, in the past few months, I've seen clients with horses on stall rest that they've had all these new toys that they found that are almost similar to like a dog with a Kong. Like I've seen the hay pillows and I've seen the hay balls, and the horses are doing really well with those on stall rest. So again, it's kind of combining a slow feed mechanism with an enrichment toy. Because we can say that the gold standard is here. Let's try to get our horses out sometime between, 16 and 20 hours a day, for instance, or living outside 24/7. We can say that's the gold standard, but that's not really reality. There's a lot of horses in the world that can't live in that environment for whatever reason. So I think if they have to be in, the more enrichment we can give them, the happier they'll be. And, another thing that we've noticed too, and this was actually in this paper that I was just reading before we came on, was the stalls that don't have windows on the sides where the horses can see each other. That was actually a risk factor for development of ulcers. And we have that a lot in Florida, where some of the shed row barns that are concrete block, they won't have the windows between the stalls, and those horses can get really agitated. So that was actually published that was a risk factor when the horses couldn't see other horses when they were inside.
Wow. It makes sense. Like that, I can definitely see that causing issues. Sarah, if you do happen to try any of those enrichment toys, please report back. Photos and videos are always appreciated. So of course we got a lot of questions about like supplements related to ulcers, and What are your thoughts? I mean, so Amanda's asking, she'd love to hear your thoughts on giving ulcer guard or sucralfate. Sorry if I mess that up.
So I think it's always great if you have a horse that can be nervous on the trailer or when they go out for outings. It's always nice to give them the quarter tube of Gastrogard or the 1 dose of Ulcer Guard before they trailer. I think down here where our horses are trailered out 5 to 7 days a week, I think that can get prohibitive, and, you know, both from a cost standpoint and then just a practicality standpoint. I do have some horses that are living on sucralfate right now, some client horses. And I think the important thing to remember, and, you know, for me as well as clients, is the sucralfate is a drug. It's not a supplement. And so we do have some horses that it does seem to keep them really good if they're living on it. They've seen some situations in people when people take it that they've had some aluminum toxicity because it is an aluminum salt of a particular compound. So I did look that up the other day in horses, and they're not reporting that in horses right now. So in terms of cost, that drug can be a lot less expensive than some of these supplements that the horses are on. So I do have some clients that are choosing to keep their horses on sucralfate all the time. You know, we haven't really talked about the 3 main drugs that we use to treat ulcers that are FDA approved. And so those would be Gastrogard, sucralfate, and misoprostol. And so I touched on it a little bit earlier when we talked about, you know, when you scope, you at least know what grade you're dealing with, and you know what type of ulcers you're dealing with. Your Gastrogard or your omeprazole is going to be your mainstay for squamous ulcers. And so that's the drug that's been around for forever. Everyone knows it. One thing I would definitely throw out there with that drug is there were many, many years, and maybe even over a decade, that people didn't realize that they needed to fast a horse before they gave the omeprazole. So the current recommendation on when you give a horse Gastrogard is you give it in the morning. Theoretically, they eat less in the early morning hours, even if they have free choice access to hay or pasture. So say you go out to feed at 7, if you have a horse on Gastrogard, they'll get their Gastrogard, and then they've kind of backed down the recommendation about fasting after you give it. It used to be an hour after they were given the Gastrogard before you could feed. Now, you know, some people are saying 45 minutes, some people are saying 30 minutes, but ideally you want the horse's stomach as empty as possible when you give them the Gastrogard. And then you need to withhold feed for, you know, I would say at least 30 minutes, if not 45 minutes or a full hour after that. And then you can also add, if your squamous ulcers were very bad or even moderate, a lot of times I will add in the sucralfate. That will form a slurry in the stomach that will act as a physical barrier, and it will prevent the hydrochloric acid in the stomach from back flowing into that ulcer. So it binds to it and forms a Band-Aid. And then for glandular ulcers, primarily you're using the sucralfate with the misoprostol. There is some discussion on whether or not you need to use Gastrogard with those. I usually will at least put them on a low dose of Gastrogard, even if they don't have any squamous ulcers, if they have glandular ulcers. But those are the 3 main drugs that we're using in different combinations to treat all the different types of ulcers.
Got it. And Hannah's wondering, does the fasting apply if you're giving the 4th tube of Gastrogard for prevention?
Yeah, I would say yes. I mean, you don't want to ever give that. And it's crazy to think about it now, but when Gastrogard first came out, I mean, you would be at a horse show and you would see a groom, and the horses would all be eating hay, and they would go and they would just put the Gastrogard in the mouth, and the horse would either spit it out with the hay or, you know, it wouldn't get absorbed. So even if you're doing the quarter tube, I would still try to do it on as empty of a stomach as possible. Again, you know, we have the gold standard versus the reality, and even say the best you can do is 30 minutes before, 30 minutes after. That's still better than walking up to them with their stomach full of food.
Yeah. And it makes your money go farther because you're getting more value out of what you're feeding.
Absolutely. There have been a few times where I have scoped horses before and after treatment, and you'll go in 30 or 45 or 60 days later, and you sit there and you think, all right, now what is going on here? Because I know this horse has been on the right drugs. And then you find out that management wise, and again, sometimes it's tough if you're in a boarding situation and you can't quite make the management work, but maybe you spent $1,200 on treatment and then you find out that things weren't being given the way that they should have been given. And it really does make a difference on the repeat scope.
Absolutely. Does sulfate need to be fed 3 times a day to work, or will 2 help? And also, is 20 minutes after enough time before feeding grain?
So,
Or sucralfate?
yeah. So a lot of times on sucralfate, we actually are feeding that in the grain, and there can be different opinions on that. I would say based on what I've seen in practice, I think it works great fed on grain. You do want a minimum of an hour after your gastrogard. And then if you're also feeding misoprostol, you want a minimum of an hour or two is better in between all of these things so they have time to work. But for a long time, people thought that sucralfate, you only could feed it as a liquid and it had to go by itself with no feed. I have a lot of horses that do really well with it on feed, and twice a day is fine. And that was one of the things that was covered in the most recent review article, was just the range that people are prescribing sucralfate. I mean, anywhere up to 4 times a day. And I mean, it's all over the board. So I've seen all different doses with horses coming here in the winter that, they come from all different parts of the country and they're all in different doses. So definitely that twice a day is still helpful.
Well, that's great news. Caitlin, and I'm sure everyone else is also wondering, are there ulcer preventative supplements that you're recommending, like on a day-to-day basis?
So that one is really hard because I wish we had a magic silver bullet that we could just say, put everybody on this. So usually what I tell people, and my clients know I'm generally pretty anti-supplement. So I have to be very careful when I go through all of them as far as what has research, what doesn't, what's just marketing. So currently there are 3 supplements that have colic care in some form attached to them. So Arenas Animal Health has colic care, Smart Pack has colic care, and Platinum Performance has colic care. And so what that means is if you feed whatever GI supplement they've designated, if your horse would need colic surgery, they will pay for the cost of your colic surgery. And so especially for people that don't have major medical insurance and they're concerned about potentially having to pay for a surgical colic, I think those supplements are fine. I think that they can be pricey, but they can cover up to $15,000 depending on the company of colic surgery. And I have worked in multiple hospitals and seen those companies pay out. So I can personally vouch for they really do pay out for colic surgery. So those would be the 3 that if you're worried about the cost of a surgery and you don't have major medical on your horse and you want some type of insurance, those would effectively be insurance. The 2 supplements that I really like from a research perspective are Reline from Haggard. Dr. Slovis did a lot of work to come up with Reline. And then Benjamin Sykes is another researcher that's very well known in the gastric ulcer world, and his is Protect GI. So those are the 2 that were developed by veterinarians that really have had quite a bit of research behind those. So I would say of those 5, I feel like any of those are good choices. And a lot of it comes down to practicality and finances and things like that. I mean, I do think in a perfect world, if you can control all the environmental factors, I don't think it's necessary to feed something that's a supplement. But like we've talked about a couple times in the hour, there are a lot of horses that are living in a situation that, maybe somebody owns the horse and they don't like their living situation, but it's hard for them to change it. So those would be horses that it would be nice to have them on something.
Yeah. And Peyton is wondering about gut plasma supplements to heal the gut. Is that what are your thoughts on that? Is that kind of what the hind gut supplements you were talking about before?
Yeah, and that would be, I guess, what I would say to that rep would be, okay, show me a paper on that one. I think it is really common right now, whether we're talking about joints or gut health, to start talking about PRP, plasma, amnion, things like that. For regenerative medicine is again a big buzzword. I would want to see some research on that, like that had been put into practice.
Absolutely. And Mickey asked a question about this, and Steph's also kind of asking a similar question about Mickey is saying tips on management post ulcer treatment and resolution after a rescan. She said there's a lot of info out there, but she feels like there's been flare ups that after the initial treatment, even being on ulcer preventative supplements. And kind of in the same vein, Steph is asking, like, once a horse has had ulcers, are they at a greater risk of having them again?
I think you could say potentially based on, well, and I mean, that's a good thing to bring up too, is I've had a lot of clients over the years say, and not as much in recent years, but I would say 5-10 years ago, someone would say to me, well, this horse was treated for ulcers last year or 2 years ago, so it can't be that. And we know that horses can redevelop ulcers in 3 days. So just because a horse has been treated for ulcers, even treated well and rescope clean, doesn't mean that at some point they can't get them again, even very quickly after. So it kind of goes back to our earlier conversation about some of these horses that we can't get them resolved or they flare up again. There's some underlying cause, whether it is a naturally anxious horse and they're in an environment that's heightening their anxiety. The management practices at the barn aren't great. Say that barn does feed sweet feed. And a lot of it, the horse is on 10 pounds of sweet feed a day, and that's really hard on their gut. Or I've worked in plenty of barns where the horses got 2 flakes of hay a day. They got a flake in the morning and a flake in the evening. And I think, unfortunately, that's really prevalent. There's droughts and our hay in Florida is $28 a bale. And, I do think that there's some issues with sometimes they don't get as hay or as much forage as they need. The horse has an underlying lameness or an underlying discomfort somewhere. The horse is being picked on by his friends. The horse really doesn't get along with the trainer, or the trainer isn't a very sympathetic, empathetic trainer. I mean, I think when horses are consistently re-ulcerating, we have to look at everything from their living situation, their training situation, and see, is there something about that horse's life that is causing them stress?
And is it more prevalent to see ulcers in older horses, or does this kind of prevention and treatment, is that like also something you should be thinking about if you have really young horses?
I tend to see it in younger horses, honestly. And that may be biased because if somebody has, say, a 24-year-old retired horse, I don't get called to scope many of those horses. But would be super prevalent in a 2 or 3-year-old that's starting training, super prevalent in a teenager that's competing. So anything that is potentially causing the horse stress or anxiety, then that's going to predispose them to ulcers.
Got it. And like the treatment, the prevention is all kind of the same no matter the age. Is that fair to say?
Yeah. And I would say that there are horses that are on supplements, they're on prevention, but the management practices for them. And I've absolutely been there in terms of, I used to practice in a part of Indiana that was increasingly becoming very urban and suburban. And there would be people, and they would say to me, they would almost be in tears, and they would be saying to me, I have no other place to put this horse. This horse has to live here. And I mean, that's really heartbreaking as a practitioner, because we all know that the horse needed a better living situation and they couldn't get it. And so the owner was just trying everything that they could to get the horse in a better spot, with more turnout, or someplace that was more willing to feed hay. I mean, I had barn owners that would refuse to have extra hay in the stall. So I know that that's a very real fact of horse owning life sometimes, in this country, as we lose more land and things like that. And so we want to all try to do the best we can, but definitely increase in forage and increase in turnout is very helpful when it comes to this.
Wow. Well, this has been incredible. I mean, I want to kind of apologize because I've just been drilling you with questions for the last hour. That was a lot, and we covered a lot of bases. But thank you so much for kind of going on
Absolutely.
this ride with us and sharing your knowledge. I definitely feel a lot more educated on the topic after the last hour, and I think there's a lot more to learn. But really, really appreciate you taking the time because this is a topic that I think we all want to know more about.
No, I really enjoy it anytime.
Wonderful. Well, have a wonderful evening. And you guys, everybody who submitted questions in advance and everybody in chat, thank you so much. This, based on the number of questions, I think we can definitely do a part 2 to this one and have plenty to cover. So we'll get that on the calendar. And in the meantime, have a great evening and we'll see you all next week.